Dr. Holly Benjamin is a very, very close friend, a colleague, is one of the, if not the leading pediatric sports medicine physicians in the United States, is on every consensus document, policy in youth sports. Dr. Benjamin, we are fortunate to have you with us tonight. Thank you.
Thanks, George, so much for having me. You are always inspirational, and I've learned things tonight myself. This amazing panel that you've put together, and I'm truly honored to be part of it and to share some pearls. I will tell you, I knew I was towards the end. Mine is also fairly simple, very practical, and I'll get through it pretty quickly for you all. You can advance the slide. I have no disclosures. You can go on. All right, so today we're going to discuss just 4 quick things. We're going to discuss the risk factors for overuse injuries. We're going to define burnout, because I think it's important not just to talk about overtraining, but also burnout. We'll discuss high-risk overuse musculoskeletal injuries in soccer. And I want to talk a little bit about overuse injury prevention, because I think it applies at all levels, but particularly with my interest in youth sports and athlete development, I think it's important to address that. Next slide. I apologize. I should have taken out the animation. I didn't realize it was on there. I'm going to talk while that comes into play. So I think we've covered some of this, but the numbers keep growing. There are over 30 million children participating in organized sports, 7 million high school athletes. But I wanted to get to the injuries. So high school athletics accounts for about 2 million injuries annually. That's 500,000 doctor visits. That's up to 30,000 hospitalizations a year. So that there's some significant injuries that happen as a result of sports. Over 3.5 million children under the age of 14 are treated annually for sport-related injuries. And many of those may or may not be related to being a specialized athlete. Furthermore, overuse injuries account for half of all sports injuries in middle school and high school. We do the best that we can in the pediatric sports world to track injuries. Dr. Jayanthi's done a ton for us in understanding a lot about this, but tracking injuries is difficult. Perhaps injuries are underreported. We really don't know. Next slide. I wanted to specifically put a slide in about burnout. And I think for here, one take-home point is just that it's burnout to me is when there's a loss of enjoyment in sport participation. Overtraining might be poor performance, that might be fatigue, that might be more the overtraining. But burnout is when you're no longer enjoying what you do. And that is it is probably you're a little late to the game if you pick up on that as a coach or a parent or anything else. But that loss of enjoyment, that no longer desiring to play. And these athletes are often still playing at a very high level and still performing well, but the enjoyment of the sport is gone. And that's a big red flag that we need to take a step back and address the mental health, the physical well-being of the athletes. So please pay attention to that. I also wanted to mention that over my years in sports medicine, there's definitely been an increase in kids themselves coming in and saying that their goal is to make money during their sport. That's a very important goal for them, is to be a professional athlete. And these are 10, 11, 12-year-olds sometimes and things like that. And there's just a little reality check there that this is a marathon when you're going to be. We want a lifelong athlete. That's what we want. We want physically active adults. We want people to enjoy all sports and be physically active. That's one of the big arguments against specialization, is just exposure at a young age, so that you can play soccer, but maybe as an adult you'll transition to something different. The reality check is some statistics. 2.2% of high school girls and 2% of boys will get college scholarships. Maybe 6% of high school athletes or even high school age club athletes will ever play sports in college. Over 70% of high school athletes quit all organized sports by age 15. And only 0.2 to 0.5% of high school athletes will ever make it to professional level in any sport. So I have conversations with patients and about, enjoying the sport, being as good as you can be, but, to have other goals besides being a professional athlete, because that's really hard and that can be a letdown. And that leads to a lot of negativity and mental health issues with that. That's a really aspirational goal that maybe isn't realistic. Next slide. All right. So I think there's a little delay here. This slide is going to just highlight that, again, to the point that's been made over and over, is that early participation in organized sports and the loss of free play is sort of the beginning of part of the problem regarding sport specialization. There's just too much opportunity to play a single sport year round that didn't exist 20, 30 years ago. There's pressure, there's money, there's advertisements. You can click the slide again. And there's money being part of the problem at younger ages. So not only do we have to worry about sport specialization, but we also have to worry about specialized specialists. And what does that mean? That means you're not just specializing in soccer, but you're being a goalkeeper when you're 8 years old or 10 years old and just playing a goalkeeper. So things like that also increase the risk of overtraining, increase the risk of burnout, increase the risk of injury, increase the risk of mental health issues, and all of those things. Next slide. This next slide is a Venn diagram, and this is one of my favorite slides because it talks about the factors contributing to overuse injuries. And I explain this on a regular basis in my office when people present injured, and they say, well, why did I get injured? And I say that you have to look at genetics, biomechanics, and workload. And it could be one of those factors. It could be all three. The best example of this is, my favorite example is a cross-country runner who's running high school, let's say, 70 miles a week. And are they running too much, 80 miles a week? Is that a workload problem? Well, it might be a workload problem that they're running too much, but their teammates are also running that same amount and they're not injured. So then we'll look at, well, is it a biomechanical problem? Is it the way they kick the ball? Is it the way they throw, the way they run that's a problem, biomechanics? Or is it that the way they're built, they have genetic issues about extreme lack of flexibility or, really bad flat feet or something like that? So as I said, I like this compartmentalization and as well as understanding that there's overlap there, because it helps me understand why people get hurt. It helps me address their injuries more comprehensively, because at the end of the day, with overuse injuries, I'm often talking about the risk factors and the contributions to injury, the part that's workload, the part that's biomechanics, and the part that's genetics. And when we have this comprehensive approach to overuse injuries, we do a better job at treating and also preventing. And I say that as well to my patients and families and athletes and coaches, is that the treatment is often the prevention. So it's not the end of the day. It's not the worst thing in the world to have a 10-year-old have Sever's disease, which is like soccer heel or a tendonitis or anything like that, because sometimes that makes them be aware that there are things out there for injury prevention. It makes them be aware that they are at risk to get injured. So sometimes we spin it to the good, if that makes sense. Next slide. This next slide is an important concept that I want to address, that not just for tendinopathy, but for bone stress injuries like stress fractures and everything else. And when this little diagram comes into play, I do want to be able to say that the main thing, if you can see me, is here's onset of inflammation and abusive training and failed adaptation. Here's pain threshold. Pain threshold is much higher than when you start to get injured in an overuse model. So it's kind of subclinical, if you will. So by the time someone is experiencing pain and especially starting to fail to perform in their sport, the horse is out of the barn, the ship has sailed, whatever you want, to say is that injury has been brewing for a long time. When someone comes in with an obvious overuse injury and they say they've only had a week or two of pain, probably started being injured, 6 weeks ago or more, maybe months. So just keep that in mind. It's an important concept that it's not necessarily even having a high pain threshold. It's just the way the body works. So once you hit that, and also once you cross into recovery then, and you decrease loads, you increase strength and start to actually achieve recovery, you're still subclinical. You're feeling better, you feel recovered, but your body might not be fully recovered. So a lot of times people are attempting to return to sport and they're just going too fast. It's like couch to 5K. I don't care at what level you're at. You have to take a very graduated, very, very logical approach to returning to sport to avoid just being a yo-yo with constant re-injuries. Next slide. I wanted to highlight, and with this next slide, the risk factors for overuse injury. Yeah, you can do the next slide. Growth-related factors and what we call intrinsic and extrinsic factors. The biggest thing in kids is they have open growth plates, they're filled with cartilage, they're at higher risk for injury sometimes than even tendons and ligaments, but also just the things that about your body, that's intrinsic factors. That's your anatomic factors, your flexibility, your strength, your flat feet, your loose joints. But then there's also your previous level of injury and conditioning that have affected your body. You have mileage on your body from old injuries. And also your body's affected by your nutrition, which we've heard, and your psychosocial well-being. Extrinsic factors in some ways are somewhat easier to control. That's the way you're coached or your training progression. That has to do with scheduling practices, competitions, things like that. And then also footwear, equipment, things like that. And the influence not of yourself on yourself, but from outside. So those are extrinsic factors. Next slide. So on the next slide, we're going to talk about key points to successfully treating overuse injuries. I have 4 points I think are important that are very practical that everyone can understand. Number one is, what are you really dealing with the overuse injury? Yes, you have hip pain or leg pain, but what is really going on? Is it a bone injury? Is it a soft tissue? Just let's figure it out. And sports medicine physicians are a really good starting point for that. And then for every injury, again, I kind of talked about genetics, biomechanics, and workload, but it's also what I call a victim and a culprit. And I'll explain that in a minute here. So it's, this global overuse is in some ways just a catchphrase and a bag, but you have to really break it down as what did cause the overuse? What part of it was that? I think we all know this, but rest on anti-inflammatory medications really have never healed an injury, especially an overuse injury. It's very disturbing to athletes when they've been told by someone to rest for 4 to 6 weeks and just complete rest. And some of them are compliant with that and they do that. And then when they go back, they feel their pain comes right back. They feel injured, nothing accomplished. And sometimes they're even worse as a result of the rest. They get weaker, lose flexibility, and you're worse than you ever were. So I'm a fan of relative rest. I think it was mentioned by Dr. Perroth even for concussion. It's also for the musculoskeletal injuries. Relative rest is super important to keep them going in some way, shape, or form. And then obviously rehabilitation is the key. So the therapists are my friends. Athletic trainers are my best friends because they take care of our athletes, my patients. They make me look good because they're the ones in the trenches that really get athletes healthy from a musculoskeletal standpoint. Next slide. So I wanted to talk about victims and culprits. That's kind of a new way of thinking for me, or not thinking, but of terminology for me to explain things, but I think it works well. So what is a victim and what is a culprit? And I'll give you 2 examples. Soccer player, you can hit the next return on the slide, please. Soccer player, runner with anterior and lateral knee pain. What is the victim? The victim is the knee. That's what feels injured in the body. but what's the culprit? What's causing that knee to be sore? It might be a tight IT band. It might be a weak glute muscle. So the culprits are how you recover. So that's what you're going to focus on in physical therapy. For example, a soccer player with heel pain and Achilles tendonitis. The victim is the poor Achilles tendon. But what's the culprit? Bad cleats, old shoes, flat feet, a recent growth spurt. So again, it's just a different conceptual way of understanding how we approach overuse injuries. Next slide. I wanted to touch base in terms of when to get imaging or when to refer, because this applies to coaches, to parents, to athletes themselves about when should they speak up, when should they seek advice, and from primary care providers as well, because I function as a specialist in my world. And the basics of this: pain greater than 3 weeks, especially consistent pain, you start thinking, again, as I said, by the time you're feeling pain and pain threshold, things could have been brewing for a lot longer. So pay attention to when you see a pattern of constant pain. Obviously, any serious red flags like nighttime pain, tingling, numbness, joint swelling, that's I'd go sooner rather than later to seek care. Any acute injury or trauma, that's pretty obvious. People who go down on the field with a sprained versus broken ankle, they're going to come in right away. But sport performance, that definitely gets people in. The problem is that sport performance can be affected for weeks to months before it's truly limited to the point that they actually come in. So sometimes delays have been made by really waiting until you just can't do it anymore and seek care. Sometimes it just means the recovery period is going to be that much longer, and it can be frustrating. As far as imaging goes, obviously in orthopedics, imaging is super important. The x-ray does look at the bony anatomy, but x-ray has limitations. And I think that's my message here, is that a normal x-ray doesn't mean nothing's wrong. We're lucky enough to have amazing technology, particularly with MRI, that I can tell you in the setting, for example, of the picture I've shown here of a stress fracture in the hip, which is a high-risk injury. Probably less than 20% of stress fractures will have any x-ray finding, but almost 100% of them will have an abnormal MRI. Now, it's not to say that everybody should roll in the office, skip the x-ray, and have an MRI. That's not really, there's many things that we look at on the x-ray that are important and critical. A lot of x-rays are done weight-bearing, MRIs are done lying on the table. So very important to us, and it is the most appropriate starting point. But you have to balance with somewhat being reassured with a normal x-ray with knowing when the proper indication is to get advanced imaging, such as an MRI. And that usually is a good medical decision making, but you have to be patient with physicians and healthcare providers as they go through the process of starting with an x-ray, making recommendations, and trying to find the right appropriate indications for getting an MRI. All right, next slide. I did want to highlight with the next slide 4 high-risk areas that are overuse injuries in soccer that are very common. Number 1 is the hip. I think the hip in any sport that is presenting as an injured joint is serious, but it's one of the higher risk areas that we see. So some of the red flags with hip pain would be groin pain with weight bearing, a positive hop test on one leg, pain with rotation of the hip in and out. The highest risk injuries that we see are, nothing really is ever good with those kind of findings, but femoral neck stress fracture, a high risk is very high risk. And then certainly labral tear, sports hernias, so musculoskeletal sprains and strains, tears, are all on the table with that kind of presentation of groin pain. Number 2, tibia pain. So again, we all, soccer players are particularly challenging with their tibias because despite the protection that they use and shin guards and all that, they have sore shins very frequently for a wide variety of reasons. Reproducible bony tenderness can be shin splints, it can be stress fractures. Going beyond those kind of symptoms, I also see quite a bit of soccer players that come in with possible exertional compartment syndrome. That's a little tricky injury that occurs, but it sometimes presents with tightness, pressure, cramping in the legs. But it's hard to diagnose. It usually is pressure building up in the soft tissue compartments of the leg. You have to have a high index of suspicion for this, and there are special pressure testing that can be done for that. But it usually takes a while to diagnose it. It's not something that we usually do right off the bat. We're usually screening for stress fractures, sometimes getting blood tests in these type of athletes, making sure their iron is good, that we don't find any other metabolic health problems. And then if you have pretty severe exertional cramping that doesn't respond to physical therapy, nutrition interventions, hydration treatments, supplements, things like that, then sometimes compartment testing can be done. So it's just important to be aware of it. It's still pretty rare, but it is a real problem that we don't want to miss in terms of high risk injuries. And then just to finish up, the foot takes a lot of beating in soccer. When it comes to the inside part of the foot, the medial foot, the biggest concern I have is we do see tendonitis, we do see plantar fasciitis, but vague midfoot pain that maybe affects the arch, but also affects that medial bone that sticks out that sometimes rubs in the cleat. That can be a stress fracture of the navicular bone. Navicular bones, there's two main ones in the body. They don't have good blood supply. Stress fractures in that bone can be very serious. So bony pain in the medial part of the foot should be seen sooner rather than later in any athlete. And then lastly, I wanted to touch base on the lateral foot pain. So that fifth metatarsal bone pain, sometimes it seems like a foot sprain or an ankle sprain, but that foot pain, particularly bony pain, does raise the risk of being what's called, if you've heard of it, a Jones fracture, but that's a fracture at a certain part of the fifth metatarsal bone, and that can be pretty serious as well. Most of these high-risk injuries that occur, the treatment is different than sprains and strains. Almost all of these end up on crutches, casting, a significant amount of time off, and sometimes they even have to be treated with surgery if they're missed and they're too serious. So some of these high-risk areas should be looked at sooner rather than later. But again, basic sprains and strains are still far more common than these high-risk overuse injuries that we see. Next slide. I've got two more quick ones. The next slide is just to go over pearls for prevention. So the AAP recommends safe exercise in children and adolescents should be somewhat individualized, but some general guidelines, which just follows up everything that you've heard here tonight about playing other sports, not specializing, taking time off, things like that, actually build a better athlete. So in general, exercise limits up to 5 days per week, 2 to 3 months off per year, cross-training being encouraged, not just permitted, making sure you do strength training, flexibility training, really work the core. The core is the key to every injury prevention out there. Limits on aggressive increases in exercises, and being very cautious always about the kid that's on multiple sports at one time or per season. So some of these just are really lead to significant increases in injury risks as well as mental health stress. Next slide. I think the take-home point there is just to encourage, the more we can change the thought process that encouraging our athletes to have a couple months off from their sport of choice is just so healthy for them in so many ways. It's really important. All right. So in summary, prevention of overuse injuries, reverse the patterns of early sport specialization, which means promote diversification, educate all of us. All of us need as much education as we can about rules and safety guidelines, proper form, et cetera. And you've heard today how important healthy lifestyles are: nutrition, sleep, and recovery. Balanced training is important, flexibility and strength. And then it's always being vigilant, not paranoid, but just vigilant to injury, overtraining, and burnout. Your athletes should be happy. It's the greatest joy in the world to have athletes enjoying what they're doing. It's just amazing. And then our physicians are here to help. A lot of athletes look like they're scared of me when they come in the office. And I said, I'm here to keep you in the game, not out of your game. It might be temporary, but if you work with me, you'll be better, healthier, you'll be better, faster if we do the right thing. So that's important. And next slide. And I think that's all I've got for you.
Holly,
I had to put,
go ahead, Holly.
I just said, when this comes in, I'm sitting actually at the Sky game right now. We are in the playoffs, so I'm sitting in the back room.
I actually said that. I think the Sky's playing, and she's probably going to be there. So yes, you confirmed it for me. I'll be quick because I hope nothing.
I am in the training room.
I love the victim and the culprits. I think for our coaches, I think understanding, hey, here's the injury, and then what are the things that you can do, right, to prevent it and to recover from it. So Holly, thank you so much for a great talk. We will again make sure that our coaches across the country have access to this. As always, thanks, Holly. Really, really appreciate it.
My pleasure. Thanks.